Welcome to the Royal Australian and New Zealand College of Radiologists' 90th anniversary podcast series, where we celebrate 9 decades of excellence in radiology and radiation oncology. In this special series, we honour the remarkable careers, achievements and contributions of our members who have shaped our college and the profession. In this episode, we're honoured to feature Professor Dinesh Varma, a leading expert in trauma and emergency radiology. With a career dedicated to improving the management of trauma patients, Professor Varma has made significant contributions to the field through his clinical work, research and leadership. As the Deputy Director of Radiology and Director of Emergency and Trauma Radiology at the Alfred Hospital and a clinical professor at Monash University, he's been at the forefront of integrating advanced imaging techniques and promoting the role of clinical radiologists to trauma care. His work has not only enhanced patient outcomes, but also set new standards in emergency radiology. Professor Varma's dedication to education and professional development is evident through his numerous publications, presentations, and his role in mentoring the next generation of radiologists. He's also played a pivotal role in establishing the Australian and New Zealand Emergency Radiology Group, or RANZCR, under the auspices of RANZCR, and was recently awarded honorary membership to the European Society of Emergency Radiology. In addition to his clinical and academic achievements, Professor Varma has made substantial contributions to RANZCR through various volunteering roles. He's served as the President, Chief Censor and Chief of Professional Practice, and has been actively involved in the college's governance and strategic initiatives. His efforts have been recognised with several awards, including the RANZCR Roentgen Award and the RANZCR Gold Medal for his valuable service to the college. Join us as we explore the remarkable journey of Professor Dinesh Varma. We hope you enjoy listening to this episode.
What first interested you in following a career in radiology?
My interest goes back obviously a long way. So when I took up radiology training, I was in India, and it kind of evolved from some of my personal circumstances. I was keen to pursue a career in surgery because I had done some residency in cardiothoracic surgery, and that's where my interest was. But unfortunately, I had a motorbike accident and I broke my leg, and my orthopedic surgeon advised me that any subspecialty training that required a lot of had a physically demanding job was not going to be appropriate for me. And then I started looking at alternatives, and radiology was one of the upcoming fields at the time. And I decided to apply for the training program, which is where I got into it. And ever since I took that program, obviously some training was done in India, then I migrated to Australia, where I got into the fellowship program. And it's been just great taking up this career and never looked back.
Would you like to share some of your memories regarding the challenges, achievements and experiences of being president of college?
Look, there are lots of memories behind that position that I took, and I have been involved with the college for a long time. So I was the first junior radiologist representative on the Federal Council. They didn't have a position on the Federal Council. And a few of us who had just recently finished our training program in Melbourne set up a group called the Junior Radiologist Forum. And we applied to the college to grant us a position on the Federal Council, which was subsequently granted and had to go through an election process to find the candidate. So I put my hand up for the position, went to the elections, and I was elected as the first junior representative on the Federal Council. That, I think, was a 2-year term, and then I was eligible to apply to go for a full councillor position by election, which then obviously I tried and I put my hand up for that councillor position, and I got elected for 3 consecutive terms as the federal councillor on the council. And then I saw some of my role models who had gone on to become presidents as being councillors, and they did a great job. And they were really who inspired me to consider that when my turn came up, if there was going to be an election for the president, I would try and give it a go. and it was a challenging job. I saw how hard they worked and how they were so passionate about the profession. And I had a similar passion about the profession, having been involved with the college for so long. So one of my, not an ambition as such, but one of my desire was to become a president of the college and do the same that the others have done in the past. So that was really the driving force behind getting up to become the president and going for the job.
Okay. And do you have any achievements that you experienced while you were president?
Yes, look, when I was the president, the college went through some governance reform. So we had the federal council structure, where there were councillors who were the governing bodies, the peak governing body for the college. And during my term as my third term on the council, we were considering moving to a board structure, setting up a board and creating a faculty of clinical radiology, because there wasn't a faculty. We had a faculty of radiation oncology, and that discussion was happening. A proposal was put forward, and I was nominated to become one of the task force members to drive this whole change going into becoming a board structure. And I worked through that process, and when I got elected as the president, the timing was such that this transition from federal council to the board structure happened in my term. And I was very excited because I had been involved in that concept and the task force and trying to set up the structure, bring about some changes to the article of association, because there was a major transformation of the governance structure within the college. So having been in that position where I was actually going to change or drive the change of the governance structure gave me a lot of pride. And that was a very good experience for me. It was challenging. It was a significant change to the governance structure. And I certainly enjoyed working with my board members, who were all very driven to make sure that we created the right structure going forward. And it was a hard and a long term at the presidency for 2 years, and the days were long. But we were all working together along with the other board members, and simultaneously we were also creating, or the dean was creating, the faculty of clinical radiology. So there were changes happening in that space as well. So the board had to work very closely with the faculty to make sure that we transitioned appropriately without any major hiccups, and also carried on the normal business of the college. So it was quite challenging, exciting times for us, and we were all very positive. And I had really great team of board members who worked together with me to make that transition. The other thing that happened during my term was our long-standing CEO, Don Swinburne, also decided to retire, which meant that as the president of the board, it becomes the responsibility of the board and the president to facilitate a good, smooth retirement of a long-serving CEO, but also to employ and appoint a new CEO. So that was also another opportunity that came my way, just because of the timings of it. It's a unique experience for any president to have had those two major events happening during the term. Lots of things happen when you're a president, but these things only happen. I mean, certainly the change to board structure will not happen now, because that's established in its governance structure. The CEO will change with time, and no one can predict when the current CEO will move on and somebody else will be appointed. But then I had that opportunity as well. So it was very, very exciting, good learning experience for me. And I had to upskill myself by attending one of the courses to learn about appropriate management and appropriate governance structure. So the Australian Institute of AICD was very instrumental in sort of the courses were very useful for me to have attended.
Fabulous. That's really is a legacy to leave behind. The board structure and a CEO in 2 years.
Yes, indeed. Now looking back, I think it was a very unique experience for me.
Absolutely.
And I'm very fortunate to have been given that opportunity and to have gone through that process.
Yeah. Wow. Would you like to share any memories specifically regarding the development of radiological equipment and technologies?
Look, radiology is an ever-changing specialty, especially when it comes to technology, new techniques, new technologies. And there's never a dull moment in radiology because advances in technology are happening across every platform. And we use a lot of information technology, IT stuff. So it's not surprising that radiology is one of the specialties where we're going to be seeing changes every time. I think the PET scanner was something that was being established, and a lot of PET scanners were being set up around the country and in New Zealand. So bringing about some of those principles of how do you credential staff to be appropriately trained to provide the service was being discussed and was challenging to establish guidelines for that. We worked through the Faculty of Clinical Radiology, and still there's work in progress in that area. Developments happening in interventional radiology, so there are new therapies being used as definitive treatment, especially in cancer treatment. So that has always been a new space for more recent developments, and we're going to see more and more of that going forward. So that also kept us on our toes, keeping abreast with those changes. In CT scan and MRI, there was changes happening around more functional imaging. And that's something that has been happening the last few years, but certainly getting more and more established as part of routine clinical practice. So, and the other area where we have seen changes has been in recent PACs, where we sort of store and transmit images from one facility to another facility. So that's an area where we have seen much robust transmission of images, faster images, more secure platform to transfer images. So that has really improved the way we can communicate with our colleagues who are at different sites, and in getting a second opinion of cases as well, especially for people who practice in solo practice or in remote areas. Now that has become pretty much a standard practice to get a second opinion from more tertiary hospitals as well.
What would you say was the equipment that was hardest for you to get your head around in using a particular technology?
There's not a single one that I can identify, because all of the equipments that we have been using have been in practice for a long time, and they have slowly been evolving and getting more. They're getting smarter, they're getting faster, they're getting more sophisticated. So there wasn't a single equipment that had posed a challenge. It was around transforming from a standalone equipment to a hybrid platform, which means that, for example, I talked about PET scanner. So the PET scanners have got a CT and a nuclear medicine component to it. And that hybrid equipment that are coming into use now is where the challenges are going to be for radiology, because we need to have staff who are competent in being able to report both of the modalities. And currently they belong to two different subspecialties. Ideally, you would want one person who is trained appropriately to be able to give you a comprehensive report utilizing multiple modalities. And that's still a challenge for us, because we are working out how to move forward in that direction, how to train staff to provide a more comprehensive service.
Yeah. Would you like to share any memories regarding your involvement with the college or developments in radiology you have witnessed over your career?
I think what's happened in radiology over the last decade or so has been the evolving clinical role of the radiologists. So, and that's one of the strategic directions of the college, is to try and promote the clinical role of the radiologist, so that you're seen to be an effective and a significant member of a multidisciplinary team, which is looking after patients with complex medical conditions, and being able to provide an opinion that is going to facilitate appropriate management of the patient. So that role of the radiologist is what I'm also very passionate about, because I firmly believe that every radiologist should be a very integral part of a multidisciplinary team, and you should be available to provide an opinion at the time that an opinion is required, so that your colleagues that you work with, they may be doctors, nurses, physiotherapists, occupational therapists, get the best out of you and to provide the best care for the patient. Radiologists usually provide that opinion via the report they give on a piece of paper or through emails, whatever they do. To me, that's okay, but it's not how I would like to see the role of a radiologist. I would like to see everybody being present and being available to progress the patient management and being available to provide an opinion when it's required at the time that the patients are being treated. And that's something that we're evolving with the new trainees coming through. We are emphasizing that that's what they should be seeing themselves, and that's the role they should be expecting to perform when they become consultants. It's sometimes difficult to change that perception and the mindset amongst radiologists who are senior and have certain ways of doing their business. But I think the trainees, if they can understand that this is how we expect to be seen as in the medical community, in the medical fraternity, and this is our role going forward, then I think we will see a major transformation in the role of the radiologist. Equipments will come and go, the different equipments that will see developments happening, and we will learn to use them as and when they arise. But this is a major paradigm shift in the role of the radiologist, which I think is very important for us to promote and to sort of ensure that every radiologist is a clinical radiologist going forward.
Upon reflection, which moment in your career are you most proud?
Look, I think it's not a single episode in my career that I can say which was a turning point as such. But when I look at my profile or my whole landscape of my involvement with the college, starting at what was one of the most junior positions as a junior radiologist and ending up as the president, is probably one of my most, not sought after, one of my best periods of my career with the college, because really I don't know of anyone else who's done that, who's started. There may be some in the future who might end up becoming and traveling through that journey, but that's what I see as being one of the episodes in my life that I'm very proud of. And that's something I'll cherish for all time to come, because it's something that I've done right from the beginning and ended up so-called at the top end of the college.
Yeah, fabulous, absolutely. Are there any other highlights or lowlights you'd like to share today?
I think when difficult issues were being discussed at the previous council or on the board, the things I enjoyed most with my involvement with the college business was that irrespective of where your colleagues come from, whether they are from private practice or from public hospitals or standalone practices, whenever any issues were being discussed which were relevant to the profession, the members and your colleagues focused and discussed that issue on the merits of that issue. They didn't bring into discussion their own background or what would benefit one from the other. It was all done very objectively and in the best interest of the profession. So I think that's one of the highlights in a way, because you have people that you work with who are very passionate about the college, who want to do the right thing by the profession and by the patients. That's something that I feel that has been one of the highlights working with the college. I haven't had too many lows, but obviously there were tricky episodes that came to discussion, and you sometimes made a decision which you felt was the best decision to make. And obviously it's not your decision, it's a decision that you arrive at after consultations with the board members or the faculty council, and you have to sort of stand by that decision. And the membership, which is the whole fellows that are practicing, may not quite support that decision. And then you sort of feel a bit low that, you sort of trying to do something which most people believe is the right thing to do, but not quite supported by the larger fellowship whom you are representing. And that's has happened without going into the specifics of any issues on a couple of times during my term, which made me sort of feel a little down, because I think I thought I was doing the right things. The board felt they were doing the right things, but obviously the membership didn't think so. And we learn, because we have to go by the people that we represent, and we reviewed those decisions and we had to sort of revise them and take a different stand. So those are some of these areas where not exactly low as such, but you feel that you could have done better and you could improve upon it. Maybe there was need for a wider consultation on that issues before you arrive at a decision, rather than just doing it by a select few. So that's where you felt that, yes, look, I wish I hadn't done that. I wish I had done it differently. But, whenever you look at issues retrospectively, you become wiser.
Yeah.
So that's about it. But in terms of my time with the college, it's been absolutely fantastic. I have worked for quite a period of time, and we've had fair few challenging situations where we have had to discuss some very sensitive issues. delicate issues that involve not only radiologists but other craft group like sonographers, radiographers, physiotherapists, nurses, other colleagues from other specialties, and you need to be very balanced about your decisions. It's not just about yourself or your colleague, it's about everybody else that you work with. And I think when you put the issues on the table and discuss it very openly without any bias and come out with a consensus, then I think you feel very satisfied. So that's really been one of the ways that most of the difficult issues have been dealt with. I'm back at the college now, so I did take some time off after having done that, but an opportunity came up for me to go back and do some more service to the college. So I put my hand up to be elected as the chief censor. And I've always been very passionate about my trainees. They are the future of the profession, and any time and effort put into them to make sure that they are the future ambassadors and the future workforce who are sound is worth it. And we have a fairly large set of trainees at the Alfred. We got 18 positions, and I've been the director of training at this campus for many years, and I had to give it up when my life in the college got busier and busier. But now to go back and serve the college in the capacity of chief censor takes me back to my trainees, not only at the Alfred, but across Australia and New Zealand. And I think I'm feeling very happy about it, that I can still do a bit more, and didn't get to do too much in the area of education and training during my term with the college, because there are other issues to discuss. My job description was different, although those issues were being discussed, but I wasn't very directly involved with that. But now it's kind of my responsibility in a way, and I'm feeling very happy about it.
Fabulous. Associate Professor Varma, this concludes our interview today. So thank you very much for your time. The information you have provided today will be a source of valuable asset for the RANZCR archive and the future radiologists and radiation oncologists in the future.
Fantastic.
So
I must say that I think I have focused quite a bit on radiologists as such, but the college is for radiologists and radiation oncologists. So one of the things that I felt very proud of was that my successor was Professor Chris Milross, who was a radiation oncologist, and it was nice to see that he put his hand up to become the president, because it's always good to be able to get both radiologists and radiation oncologists to represent the college. After all, we are one college. So although I've been focusing mainly on radiology in the last few questions, but certainly radiation oncology is a very important part of our college, and they do a fantastic job. So I haven't actually sort of mentioned too much about that. I'm not sure. Maybe some of the areas where I'd like to mention about radiation oncologists would be, they are a fantastic part of the college who provide the radiotherapy aspect of the treatment of the cancers. And we are one college, so we work with them, but they have all along had their own faculty and their own dean. With the merger of the board, that we have had representation at the board from both sides, which we did at the faculty as well. We have some shared work that we do together, and when it comes to planning for treatment, that's where we sort of provide and work together in working out what's the area that needs to be treated and mapping it out together. So that's certainly a common ground for us to work together. And as I said, they do a great job. They've been always a very important part of our college. And going forward, I can see that they'll certainly be working closely together with radiologists more and more, especially given that we are moving towards hybrid equipment where we're going to be providing information from multiple modalities on one platform, which will then be utilized by our colleagues, either they are surgeons or physicians or radiation oncologists, to provide the best treatment for the patient. So certainly, I guess in terms of anecdote, what I can say is that I see the profession in radiology, radiation oncology, and nuclear medicine as one which started off as very robust subspecialties in their own, but unfortunately they all went very divergent. So they specialized in their own ways very robustly, and now we are seeing a convergence. So we're all coming together again and the reason we are coming together is because of advances in technology. Is bringing us back together. So that's one thing good for us.
Yeah, that's fabulous.
Technology can do a lot of things,
Yeah, absolutely.
Yeah, so certainly one of the effects we are seeing is on convergence of various subspecialties.
Mm-hmm. Anything else you'd like to add?
No, I think that's pretty much it.
No?
Eva, thank you for the opportunity.
Thank you for joining us in this episode of the 90th Anniversary Podcast series by RANZCR. Stay tuned for more episodes featuring the remarkable stories of our members. You can find more information and updates about our 90th anniversary celebrations on our website and social media channels. Until next time, thank you for listening and being a part of this milestone celebration.